I'm Jose Castillo-Mancilla. I'm a clinical researcher, and I've been working with the IDCAP system for about a year. The IDCAP system has a sensor within a capsule that is used to over-encapsulate a person's medication. And once that IDCAP hits the stomach, it dissolves, and that sensor generates a signal captured by an electronic reader that sends a signal to your cell phone. In clinical practice, the IDCAP system is very valuable because it demonstrates that a patient is taking medications as you would expect them to do it. And if not, identify early on that there is a problem, and then we can talk to the patient to identify what do we need to do to address it. For the patient, it's a positive feedback because when they take their pills and they get a signal that ingestion was documented, that positive feedback facilitates the patients to continue in that positive trend. Going to the doctor requires an in-person connection with your provider. But when there are barriers to doing that, like a 5-hour drive to the clinic, lack of transportation, need for the patient to work, having this potential daily check-in is really valuable because it can keep us connected with the patient, can keep the patient connected with the clinician. The IDCAP system will allow us in the future to have a more of a personalized approach to who of our patients are the ones who require a little bit more intense counseling, and I think it could potentially help keep patients out of the hospital. I think the overall experience of our study participants so far with the IDCAP system has been very positive. They have been able to navigate it quite easily and be engaged with the system. The IDCAP system is going to open up a new field of research in a way that we will be able to truly understand the value of adherence for any chronic condition in clinical medicine. Our team at eDetectRx has been excellent and have really helped us understand the technology and implement it in our study, and really have been available to us throughout the course of our study to better implement what really we're looking for. I think the ingestible biosensor technology is revolutionary in that it will allow us to strengthen the relationship of doctors and clinicians, providers, and clinical outcomes for our patients.